So good morning. Today I'm gonna be assessing the 12th cranial nerve. And to start, I'm going to ask the patient what is her name.
My name is Raisa Kapasin.
And I am Mariela. I am your nurse today, and I'm gonna be assessing your 12th cranial nerve. And before to start, I'm going to perform a hand hygiene. I'm gonna put on gloves because I'm gonna be exposed for fluid. Then I'm going to put PPE if indicated, and I'm gonna close the door and close the curtain to provide privacy to the patient. And to start, the first cranial nerve I'm going to assess, which is the olfactory nerve, which is the type of sensory, and the function of it is the sense of smell. So to test it, I'm going to put something on the patient's nose, and she is going to identify what smell it is. So I'm gonna let the patient to close her eyes. Kindly close your eyes and kindly occlude one of your nose, and I'm gonna put something under your nose, and then you smell it. What is it?
Alcohol.
Okay, on the other side.
Alcohol.
And before to do this, ask the patient to remove any mucus or obstruction on her nose for she can smell clearly. And as I do the assessment, the cranial nerve is intact, so she can smell both of each of her nostrils. Next, I'm going to be assessing the optic nerve, which is the number 2. The type of it is sensory and the function is vision. So first, I'm going to test the peripheral vision assessment by doing the confrontational vision test, visual field. So I'm gonna let the patient stand in front of me, length away. So I'm gonna ask the patient to cover her left eye. So I'm gonna cover my right eye. So I'm gonna I put a number on my finger, and she's going to tell me how many fingers did she see.
2. 2.
On the other side.
2. 2.
Okay, so she do that with ease, and both of her eyes accommodate as she can read the fingers that I put on my fingers. Next is I'm going to test the visual acuity using the Snellen chart. So I'm gonna let the patient stand 20 feet away from the Snellen chart, and before to start, I'm going to ask the patient if she wear glasses. Do you wear glasses?
Yes.
As we can see, she wear glasses, and if she wear glasses, she is allowed to wear it for she can read the Snellen chart. So can you read which line?
8.
So can you read it?
D, E, F, P, O, D, E, C.
Can you cover one of your eye?
D, E, F, P, O, D, E, C.
So the other side.
D, E, F, P, O, D, E, C.
So she can read the line number 8, which she has a 20/20 vision for a normal person to have. So it means that she can read 20 feet away with a normal vision of 20. So that cranial nerve is intact. Next, we are going to test the cranial nerve number 3, which is the oculomotor nerve. So can you see it right there? And the number 4, the tracheal nerve, and the number 6, which is the abducens. So the type of it is motor, and the function of the oculomotor is it innervates the extrinsic eye muscles and ciliary muscles, and then for the trochlear, it innervates superior oblique muscle. In the abscess, it innervates the external rectus muscles. And important of the tree is the tree should be operate as a unit, and it should be tested and evaluated together. First, we're going to assess the extraocular movement. So I'm going to ask the patient to look at this pen light. So I'm gonna put it 12 inches away from the patient's nose. So I'm going to ask the patient to look behind. I'm gonna look at the pen light and follow where I going to move the pen light. So as I'm going to move it on the 6 cardinal gaze. So I'm going to move it on the upper left. the far left, lower left, upper left, upper right, far right, and lower right. So her eyes move equally and coordinated as she follows the 6 cardinal gaze, as we're looking for any involuntary movement or what we call the nystagmus. Next, we're going to test the papillary responses, and as I'm going to do it, I'm going to dim the light. As I dim the light, I'm going to test for the patient's eyes to dilate as I light her pupils from the side to see if her eyes constrict. So as I'm going to do this, I'm going to light the pen light on this side going to her eyes. And as I light her pupils, both of her pupils constrict and it is well coordinated as I light it. Next is I'm going to assess the accommodation. So I'm gonna turn back on the lights. So to do this, I'm going to use the pen light, and I want her to focus on on a distant object, and I'm going to move the pen light close to her nose, and I want you to look also on the pen light as I move it towards you. So can you look at it? So as we can see, the pupils are equal and reactive to light accommodation, or what we call as the perla. And as I test the three, all of them, the cranial nerve of her is intact. And next, I'm going to perform or test the trigeminal nerve, which is number 5. And the type of it is the motor and sensory. So the function of it is to chewing movement by innervalor of masseter, temporal, and the mouth of the patient. So I'm going to ask the patient to clench her teeth as I palpate her temporal, the mandibular muscle here. Then I want you to open your mouth against my resistance. So as I do it, she can do it at ease, and the temporal and the masseter muscles contract bilaterally, and that cranial nerve is intact. And next, I'm going to perform the cranial number 7, which is the facial nerve, and the type of it is motor. So the function of it is I'm going to test the facial expression, the pace of the patient, and the sensory and the lacrimal of the patient. So to start, I'm going to let the patient to close her eyes and open her eyes. And can you smile? Can you frown? Can you puff up your cheeks? So as she do it, she can do it at ease, and as I can see, her face is symmetrical. There is a lines, wrinkles, and symmetrical facial movement as we do the cranial nerve 7, which is the facial. Next, I'm going to test the cranial nerve number 8, which is the vestibulocochlear, and the type of it is sensory. The function of it is hearing and sense of balance. Thus, and to do this, I'm going to occlude one of her ears. I'm going to say a 2 phrase. So she need to tell me what did I say. 2, 3,
2, 3,
4, 5.
4, 5.
So she do that at ease, and she can hear it. So next I'm going to test the glossopharyngeal, which is the cranial nerve 9, and the vagus nerve, which is the cranial nerve 10. And the type of it is motor and sensory, and the function of it is by swallowing movements of saliva, secretion, and the gag and swallow reflex. And as I do this, I'm going to test for the pharynx and larynx as well, and the taste of the posterior of her tongue. And also, I'm going to check the autonomic innervation of her lungs, heart, esophagus, and stomach. And first to start, I'm going to test the motor function, which is I'm going to ask the client or the patient, to ask the client and the patient to open her mouth and say ah, as I'm going to look at the patient's ovula, and I can see that the ovula is in the midline and it is normal. Then I'm going to test the God reflex as I'm going to touch her ovula slowly. So the God reflex elicit, which is the cranial nerve is intact, and I'm going to take note the client's voice quality. And as I do the two cranial nerve, everything is normal and everything is intact for the patient to have. And next, I'm going to test for the cranial nerve 11, which is the spinal accessory, which the function of it is motor, which is the type of it is motor, and the function of it is innervates the sternocleidomastoid and the sphenoid and the trapezius muscle. So to test it, I'm going to let the patient to move her head side to side, up and down, and the client move it easily at ease, and there is a symmetric and strong contraction of her muscles. Next, I'm going to test the cranial number 12, which is the hypoglossal. The type of it is motor. So the function of it is it innervates the tongue muscles. So to test it, I'm going to let the patient to let her tongue out, and can you move it side to side? So as we test it, she can do it at ease, and that cranial nerve is intact. And that would be all. So before to end, I'm going to wash my hands to prevent the spread of microorganism, and to throw the gloves on a proper garbage. Then I'm going to document all the findings for further diagnosis and examination. And that will be all. Thank you and God bless.